And with more than 12,000 confirmed COVID-19 cases, Nigeria's Center for Disease Control has warned that the nation is at the beginning of a very bad outbreak. The number of infected persons have continued to rise since Nigeria recorded its first index case of COVID-19 on the 27th of February this year. Now, that is discouraging considering the amount of funds Nigeria has voted to battle the pandemic, apart from financial and other forms of support from local and international donors. And public affairs analyst Alfred Jagdin joins us on the news for an expert view on this. Good to have you join us, Alfred Jagdin. When you hear reports like this, that we are just at the beginning of this outbreak, when you look at how much we've spent on palliatives, on trying to curb the spread of this virus, what are your concerns?
Well, my concerns are, as it were, the availability of test centers is still very low. For an estimated 180 million people, and I understand we have just about 30 laboratories, that is pretty low. But, you know, many have been calling for social responsibility. Many have been calling for personal responsibility. I understand the fact that people have lost their freedom for almost 4 months as a result of the lockdown. And hence, this is actually a global phenomenon. Everybody wants to go back to their normal lives and what have you. But when you look at the way people are handling issues, I'm afraid the PTF is very correct to say that we are actually at the threshold of probably a new wave of infections. Now, I want to believe people are doing what they are doing largely because, as I did mention earlier, they have lost so much of their freedom. If we also look at it, there is a high rate of survival as far as COVID-19 is concerned. And as a result, people take it for a joke. Nobody wants to be or, you know, take it with the seriousness it deserves.
All right, so you have noted the concern of a lot of people, which is that when we had fewer cases, people were more cautious as to trying to protect themselves from contracting the virus. But it looks like now that we have more cases, a lot of people have thrown caution to the wind. As you see, a lot of people do not maintain that social distancing anymore. So, but curbing the spread of this virus largely depends on behavioral change. So what do we do to drive that behavioral change in the country?
Well, we can't afford to give up. We have to go on, you know, raising awareness, because as it were, there are people who still believe that COVID-19 is just not true. You know, in spite of the myth, in spite of the conspiracies, if anybody is in doubt that COVID-19 is real, I'm afraid such a person should, anyway, I don't know what to say, but it is real. And hence, when it comes to issues that border on social distancing, if it comes to issues of wearing a face mask, if it comes to issues of personal hygiene, I don't think that is really too much to ask for. You know, going under a ventilator is not the best of happenstances. Nobody should want to expose themselves or their family members to, you know, this kind of situation. I want to appeal to all Nigerians, wherever you are, COVID-19 is real. Nobody needs to tell you that. We have lost prominent Nigerians. We have lost not two prominent Nigerians. In the course of your earlier remarks, you did make mention of the fact that 60% of the deaths related, you know, in the Kano incidents, you know, was COVID-19 related. Why should anybody be in doubt? We already know what the parameters are. It has been out there in the open that this virus can only be transmitted through human contact. Why not stay indoors unless it is absolutely necessary? What's the point in trying to rush back to work? What's the point in trying to rush back children to school just because you want them to go and write WAEC? If they die as a result of COVID-19, of what essence is that?
I'm afraid, Alfred Jagdin, we do have to let you go. Many thanks for sharing your perspective with us on this issue.